Warning: 8 shocking diabetes skin signs you must know. What if your skin could talk? What if those stubborn dry spots, mysterious dark patches, or cuts that refuse to heal were shouting warnings about diabetes? Most people overlook these signs, thinking they're just quirks, but I'm Dr. Healthy, and after decades decoding the body's secrets, I'm here to tell you, your skin's spilling the tea. In this video, we're diving into 8 jaw-dropping skin signs of diabetes you can't ignore. Packed with stories, science, and life-saving tips, this isn't just a watch, it's a wake-up call. Hit subscribe now, stick around till the end, and get ready for a flood of must-know info that could change everything. Trust me, you'll want to like and share this with everyone you care about. Let's uncover the truth together. 1. Dry and itchy skin, the desert you didn't sign up for. Imagine your skin as a lush garden, now picture it turning into a cracked, itchy wasteland. That's what high blood sugar does. It's not just about feeling uncomfortable, it's a sign diabetes is meddling with your body's plumbing. Tiny blood vessels and nerves that keep your skin plump and hydrated get battered, leaving it dry as a bone. Then there's the immune system. Diabetes knocks it down a peg, inviting infections that turn a scratch into a red, swollen mess. Poor circulation. That's the cherry on top, starving your skin of oxygen and nutrients until it's flaking and pleading for help. Take Sarah, a 45-year-old teacher I met years ago. She laughed off her itchy arms as winter skin, until a nasty infection sent her to me. Her blood sugar was sky high, and that itch was her body's SOS. Or consider how diabetes can dehydrate you from the inside out. Frequent urination from high glucose pulls water away, leaving your skin parched. It's a vicious cycle. Slather on a thick, fragrance-free moisturizer, look for ceramides or hyaluronic acid, twice a day. Drink water like it's your job, aim for 8 to 10 glasses. Keep blood sugar steady with low glycemic foods like sweet potatoes or lentils. Spot redness or blisters? Don't wait, see a doc. Oh, and if this hits home, like and share, you might save someone from Sarah's fate. Try a humidifier at night, it's a game changer for locking in moisture. I've seen patients swear by it, and the science backs it up. Dry air sucks hydration right out of your skin. 2. Dark, velvety patches. Acanthosis nigricans. The insulin overload clue. Ever glanced in the mirror and spotted dark, velvety patches on your neck, armpits, or groin? Don't grab the scrub brush, this isn't dirt. It's Acanthosis nigricans, a skin condition tied to insulin resistance, the hallmark of type 2 diabetes. When your cells snub insulin, your body cranks out more to compensate. That excess floods your bloodstream, revving up skin cell growth until you've got these thick, shadowy patches staring back at you. James, a 38-year-old trucker, walked into my clinic convinced his neck patches were road grime. A quick test showed prediabetes. Those patches were his body's billboard. Obesity's a big player here. Extra fat messes with insulin sensitivity, but so are hormonal imbalances, think PCOS, or meds like corticosteroids. Even rare conditions like stomach cancer can trigger it, though that's a long shot. I've seen this in teens too. A 16-year-old girl with early insulin resistance shocked her family into healthier habits. Slash processed carbs, swap white bread for whole grains like barley. Move your body. 30 minutes of brisk walking daily can drop insulin levels. Topical retinoids might fade patches, ask a dermatologist, but the real fix is tackling the root, blood sugar. Spot these? Get a fasting glucose test. Loving these insights? Subscribe, we're unpacking more health gold ahead. Studies show losing 5 to 10% of body weight can slash insulin resistance by up to 50%. That's not just science, it's hope you can grab onto. 3. Skin tags, small bumps, big signals. Those tiny, fleshy flaps on your neck, chest, or eyelids. Skin tags. Harmless? Sure. Random? Not quite. High blood sugar and insulin resistance, diabetes's dynamic duo, can spark these by turbocharging skin cell growth. Toss in hormones like estrogen or growth hormone, and you've got a recipe for these pesky hangers-on. Maria, a 50-year-old mom, used to joke about her necklace of tags, until a checkup flagged prediabetes. She cut sugar, started yoga, and watched them stall. They're not a crisis, but they're a nudge. I've seen them cluster in folks with metabolic syndrome too, high sugar, high BP, and extra weight. It's like your skin's waving a flag, check me out. Load up on fiber, think chia seeds or broccoli, to steady glucose. Walk after meals, 15 minutes can blunt sugar spikes. Annoyed by them? A derm can snip or freeze them off. If this resonates, like and share, let's keep the convo going. Vitamin D might help. Low levels are linked to insulin resistance, and I've seen patients perk up with a daily 2000 IU dose. Check with your doc first. 4. Diabetic dermopathy, shin spots that spill secrets. Light brown, scaly patches dotting your shins. That's diabetic dermopathy, shin spots in diabetes lingo. High sugar hammers small blood vessels, choking off the skin's blood supply. Over time, those starved patches harden into these telltale marks. They're not painful, but they're stubborn, popping up on legs, thighs, or arms. Tom, a 60-year-old retiree, thought his shin spots were just aging, until I linked them to his decade of diabetes. Genetics can nudge this along, and so can lousy control. I've seen worse cases in folks who skip meds. Coexisting issues like kidney disease can amplify it too. It's not universal. But it's a clue worth noting. Boost circulation with leg raises or ankle pumps, 10 minutes daily. Moisturize with urea-based creams to soften scales. No cure, but tight sugar control slows progression. Subscribe for more ways to outsmart diabetes. We're in this together. Compression socks can help circulation. A patient of mine, a 55-year-old runner, swore they kept his shins happier. 5. Nail changes, your fingertips cry for help. Thick, yellowed, or crumbly nails. Diabetes might be the puppet master. High sugar tanks your immune system, rolling out the red carpet for fungal infections like onychomycosis. Nerve damage or poor blood flow can thicken nails, while discoloration, yellow to black, signals trouble. Lisa, a 42-year-old nurse, ignored her funky toenails until a fungal infection sidelined her. Nails aren't just vanity, they're health barometers. I've seen black streaks scare patients into thinking cancer, but often it's just diabetes playing tricks. Wet feet from sweaty shoes. That's a fungal breeding ground. Keep nails short and dry, soak in vinegar weekly for fungus. Boost immunity with zinc-rich foods, pumpkin seeds. See odd colors? Get a doc's eyes on it. Share this with a nail biter, it's a wake-up call. Tea tree oil drops on nails, antifungal and cheap. A patient swore it cleared her mess in weeks. 6. Skin infections, the Invaders diabetes welcomes. Diabetes turns your skin into a buffet for bacteria, yeast, and fungi. High sugar cripples immunity, nerve damage dulls pain sensors, and moist spots, toes, armpits, groin, become infection hubs. Staph boils, candida rashes, you name it, diabetes says come on in. Mike, a 55-year-old chef, battled growing yeast infections for months, clueless it was his sugar spiking. I've seen toe webbing turn red and weepy too, all from neglected glucose. Warm climates make it worse, humidity's their BFF. Scrub daily with mild soap, pat dry like it's treasure. Control sugar, infections hate that. Spot pus or heat. Doc time. Like and subscribe, we've got more battle plans coming. Probiotics, yogurt or pills, can balance skin flora. A 2023 study showed fewer infections in diabetics who tried it. 7. Blisters, diabetic bully the rare rebels, big, fluid-filled blisters on your feet or legs. That's Diabetic Bullae, a diabetes VIP pass from nerve damage and rotten circulation. Not every blisters this, shoes can rub too, but long-haul sugar chaos sets these up. John, 65, found them after skipping foot checks for years. His 20-year diabetes run left nerves numb and blood sluggish. I've seen them heal, but only with obsessive care. Friction's a co-conspirator, tight boots on numb feet. Recipe for disaster. Daily foot inspections with a mirror, cushioned shoes, and sugar control. Blisters appear. Hands off, see a pro. Share this, it's foot-saving gold. Epsom salt soaks, if doc approved, ease swelling, a patient's trick that stuck with me. 8. Slow healing wounds, when time betrays you. A nick that lingers for weeks. Diabetes stalls healing, blood vessels shrink, nerves go quiet, and sugar feeds bacteria. Peripheral artery disease or venous issues pile on, turning cuts into sagas. Anna, 48, ignored a paintbrush nick until sepsis hit, her numb feet hid the truth. I've seen toe ulcers from ignored sores too. Smoking doubles the delay. Healing's a team effort, oxygen, nutrients, immunity, and diabetes benches them all. Wash with saline, bandage snugly, and test sugar daily. Protein, eggs, fish, rebuilds tissue, load up. Slow going. Doc visit. Like and subscribe, let's heal smarter. Hyperbaric oxygen therapy's a thing, pricey. But it's cut healing time in half for some of my toughest cases. From itch to ooze, your skin's narrating your diabetes story. Listen close, act fast, live better. Here's the deal from Dr. Healthy, your skin's not just there, it's a health detective. These 8 signs, dry patches, dark velvets, slow wounds, aren't quirks, they're diabetes dropping hints. Sarah, James, Anna, their stories prove it's real, not theory. You've got the tools now, check your skin, tame your sugar, move your body. Small wins, a salad swap, a foot scan, stack up big. Don't sleep on this, your health's worth it. Love the dive? Smash like, share it with your crew, and drop a comment, what's your skin saying? Subscribe too, we're rolling out more health bombs to keep you ahead of the game. Let's beat diabetes together, one smart step, one video at a time. Catch you next round.